Right. Hi, everyone. I'm very, very happy to have with me a dear and a proud student, Dr. Anshul Gupta, who secured an amazing rank 7 in INICET May 2023. So very, very well done, Anshul. This is like an amazing rank. How do you feel about it?
Ma'am, thank you so much. I feel absolutely amazing. And although I was expecting a good result, but I wasn't expecting a single digit rank. And I'm very happy that I was able to achieve this.
Yes, I think it is absolutely commendable. Also thinking that the paper was a little atypical, the difficulty level was on the higher side, and there were less number of repeats. Despite all those things, you've done exceedingly well, and we give you send out heartfelt wishes for this amazing rank.
Thank you so much, ma'am. Ma'am, actually, this was my second attempt at INICET. I had given the November
Okay,
attempt in which I got a rank of 715. And
okay,
I decided that I'm going to give the exam again because I wanted a better rank. So this time it was basically for me to go all in, and therefore I worked very hard. And I think that is why I was able to deal even with the slightly atypical nature of the paper this time.
I think Anshul has brought out a very, very important matter, and which really makes me feel, because when you get ranks and they're borderline ranks, and that you could have done better, right? And you go out to try one more time. Anshul, तो सबसे पहले तो मुझे यही बताओ कि इस बार जो हम तैयारी कर रहे थे, ऑल आउट जाना है, इसके लिए मोटिवेशन कैसे रहा? बिकॉज कभी कभी यू स्टार्ट वेल, फिर बीच में हम रुक जाते हैं, तो वो कैसे किया?
Yes, ma'am. My journey was no different. It also consisted of a lot of times when I thought that maybe this is not for me and I should probably give up. But ma'am, at these times, I used to look at videos on YouTube which are made by various mentors, and including you and Samir sir. And I also was a member of your Telegram group. And it was
Okay.
very heartening to see that sometimes you used to send messages which were, about general stuff and about general trend of preparation, about where it is going. And also there were lots of rich OBG discussions as well. But what I really, really liked was the mentorship that happened through that group. And I think these are the things that, keep pushing you. Plus, I was at home this time because my internship was over in January.
Right.
So I was preparing at home with my parents around. So that also served as a motivation for me because this time I wanted them also to, feel proud and basically feel that everything is, settled for the future. Because whenever you get a borderline rank, you get very uncertain about things. And then lots of discussions happen at home about what to take or whether or not to, take a seat or, go ahead and give it again. So I think all of that journey has been very interesting and I have enjoyed it. And yes, ma'am.
That's very, very sweet of you, Anshul. And I must say, I see this calmness on your face now, as if, कि लो मैंने कर दिखाया है ना? So I can see it there, and I can feel it in your emotions as well, that they are running high at this time, no matter how much you try and, keep yourself calm. So Anshul, as you said, your journey was no different, but Anshul has put in a lot of effort. He started early in his preparation from, I think, foundation years, and then he went out with T&D as well. So Anshul, मुझे बताओ, all in all, जब आप तैयारी शुरू करते हो, how was your preparation different at that time as compared to now, when you were dropping and you were sort of just in it to improve your rank?
Yes, ma'am. So actually, I think the main difference between my previous attempt and this one is that I have actually, studied with a goal. I had actually separate piece of paper on which I had written my goal, which was basically to get a single digit rank. Everybody aims for that, but you have to aim higher if you want to achieve something. So that's
Definitely,
why it was my
definitely.
goal. And I think the main difference was that I worked very hard this time because I worked in a goal-oriented manner. In my last attempt, I worked sort of goallessly, to be crude, because I did not have a clear-cut plan, and even if I did have one, I was not able to implement it properly. Maybe it was just MBBS burnout, or maybe it was because it was with internship. But I was realizing it during preparation. In November, it is, its chances are going to be thin, and that is a very important realization. So my preparation actually picked up only after November, and that is when I studied in a very goal-oriented manner. What I tried was that, as contrasted with my studying pattern in foundation years, when I actually went into a lot of depth and accrued a lot of material into my notes, where my main focus was to have the complete list for everything. Like if there are contraindications to a certain contraceptive, I should know all of them, not just some of them, and very
Yeah.
clearly, like the durations and all. So that was my focus during foundation years, which I think is ideal because you should accrue material at that point. Then in your internship, I think is when you should whittle down the stuff and focus only on that stuff which is either very forgettable or very frequently asked. So based on these two things, I used to like winnow down the notes in a way that was revisable, and that was my main source for revision during my second and third revisions. So that was my main strategy. To separate the two, what I think I would suggest is that the factual stuff, which is very obvious, should be separated from the conceptual stuff. If you are reading a certain cycle once, it should only be studied once, and after that, it should only be touching upon the facts which were there, or the pointers which were there, which were forgettable. So that was another way which I used to narrow down material towards the end.
I think absolutely very well said. And that just shows that strategy is equally important as hard work is. He has worked hard previously, there is no doubt, and that's what has contributed. But when he planned it well, I think that has put the cherry on the cake. Now, Anshul, let's get to more details now, dig down deeper, and let's ask you, you've given the INICET exam twice, Bache. Can you
Yes.
throw some light on how do you think, number one, INICET is different from NEET PG? Second, is there any subject distribution that you would specially want to recommend as far as preparation is concerned? And number three, do you think that when you're trying for INICET, you need to be more restricted into your material as compared to more wide, which is what is true for NEET?
Yes, ma'am. So the first question, how are the two exams different? So I think that the first thing is actually related to the second question as well, like what subjects to be focused on. So in ICT, I think by this time, most people know that it focuses more on the first and second year subjects, and they are going to form majority of the paper, 60%. And even the clinical questions of clinical subjects can be sort of answered or at least narrowed down, eliminated by using the first and second year knowledge. So basically that is where the focus should be. And the second difference is in terms of the time management, because I think INICET has a much more of a time crunch, because you have to do fewer questions in the same time, more questions in the same time. And then there is also the problem that the options tend to be very complicated with a lot of jumbling between A, B, C, and D, and you have to be in the right state of mind to not make silly mistakes. So this is another difference in the exams. And finally, I think the negative marking is also a little more stringent, but then, you have to go all in to get a good seat because there are fewer seats. So it's quite an interesting trade-off between how much to attempt and how much to not. So that is also very interesting about INICET as compared to NEET. Then the second question, ma'am, could you repeat it?
I think, okay, let me just jot down the things that you said, because they're excellent points for anyone who's preparing. So, this is how you know that someone has really worked hard. So he's highlighted some very important points, the subject distribution, you have to be careful, first and second year, even linked to clinicals, time management, something that he said is very important. I think this time, again, because the paper was relatively difficult, and if Anshul would agree, there are more multiple completion type questions, more, so those things take in your time. So that is very, very essential, as he said. And Anshul, यहाँ से मुझे एक और क्वेश्चन ध्यान आता है बेटा, अगर मैं ऐसा बोलूं कि अभी INICET का जो पैटर्न हो गया है, do you think that it is more theory intensive?
Yes, ma'am. Particularly this new paper that they have come up with in May, even I was very surprised because in November I was less prepared. So I found the paper slightly tougher because I knew the concept but not the answers. And this time paper was actually consisting of a lot of questions which were complete bouncers. So that was quite surprising for me. So I had gone with the intent to be very aggressive in the paper, but because of these factual one-liners, I was not, able to assess how much even to attempt. So in a hurry, I sort of attempted as many as I could and ended up with 194 attempts. So, but I really feel, yes, ma'am, you're right. The factual content is slightly increased because it could be attributed to the fact that several institutes contribute to this paper. So, if a different institute has a greater contribution sometimes, so it could be a different set of questions altogether. And I think that's what happened this time.
Yes. So this leads me to yet another question. We all talk a lot about PYQs, and there is no doubt that they are important. But do you think now with the current pattern of exams, is it about really mugging up the PYQ and its answers, or it's more, to more 360 degree around that topic because they are just asking anything?
Yes, ma'am. They're making it more and more difficult to predict, because it was chronically said that it's a predictable exam, and now it's becoming a little weirder. So, yes, ma'am, definitely this is going to be one of the things.
Okay. And as you said, you went out aggressive. How many questions do you think would you have done correct in the exam?
Ma'am, so according to the recalls that I saw, which I couldn't resist seeing, I got around 175 correct, and I had left 6 questions. So that
Okay.
leaves around 19 questions which I got wrong.
Okay, fair enough. That is, I think, a good number of correct questions, and that is why you are here in the top rank. So that is really, really well done. Okay, Anshul, can you also talk a little about your revision strategy? Close to the exam, let's say 15 days or maybe even a month before the exam. How did you change your gear and how did you sort of plan on
Yeah.
the revision part?
Ma'am, so actually I had a separate PDF on my iPad which consisted only of the schedule that I made for me. So
Okay.
it ideally should have had only one page maybe, but it has actually 13 pages because I used to change it whenever I felt it was, not going well or not seeming doable. Because, you set out with great goals in the beginning with a lot of zeal, but with time you realize that time is short and you need to strike out a few things to be able to complete everything on time. So it was a lot of modification which everyone has to do in their schedule. But ultimately, it ended up being around 3 months of first revision, proper revision,
Okay.
and then around 40 days for a second revision, 40 to 45 days. And then
Okay.
finally, a 15-day revision in which I tried to go through the 19 subjects as many times as possible. So
Okay.
my main strategy in each cycle of revision was to mark out the points which are find either very forgettable or very, very important, even though they're not that forgettable. They should always be in like a separate copy or a separate folder in my iPad, which I can revise at the end. So in every revision, I used to narrow down those pages. So like in my 40-day revision, which I talked about, that is when I made a separate folder of all the important pages in my notes. And then in those last 15 days, in the first 10, I only went through them rapidly. And जो चीजें मुझे फिर भी लग रही थी कि I will again forget this and I need to see it a day before the exam, that went into another separate Telegram group that I had made only for myself. And
Okay.
that is the part that I revised on the last day before the exam. And that is what gave me the confidence that, I have touched upon everything and I can make educated guesses, because I think this paper was all about educated guesses. And,
Yes.
if you can only make them if you're confident कि मेरे इतने correct हैं कि मैं ये कर सकता हूँ. You have to know the must know stuff to be able to guess the, slightly difficult to know stuff. So that was my strategy in preparation as well, to focus on the must know as well as the slightly extra stuff and just be complete with it.
Awesome. I think this is what is totally hats off. So this is what I call as strategy, especially when it comes to revision, because a lot of students, think that every time you do a revision, it has to be all over again of all the pages, but that's not possible. Neither it is productive. So, what Anshul has done, you should all learn from it. You have to keep making it more narrower and narrower, finding out the key areas that you forget or that are very, very probable to be asked. I think that, especially towards the end, has made him confident of his preparation and he has done well. And also, Anshul Bacha, since you talked about, the must-know topics, can you just help the listeners here and tell them that how did you figure out about the must-know topics?
So, ma'am, I think the only source which should be relied upon for this purpose is the PYQs, and
Yeah,
you should look at one source and you should do all the previous year questions from there, and you should
yeah,
just try to understand where the trend is going. Like if you're asking repeated questions on dog bites, snake bites, CPR, or stuff like that, you want to be very, very thorough with it, because it's like you're not fighting for the broader stuff, you're fighting for every question here. Because in INICET, they're going to repeat the topic again. So that's why I try to make sure that अगर इस topic से question आया है and it has repeated, so I would make sure that I would know all about the topic, so that if it gets repeated again in a different taste, I should be able to get it. So that was my one strategy to mark out the must-know stuff. And
okay,
the rest of it was which was my major mistake in November, was that I did not, revise the must-know stuff, like maybe STI kits, stuff which is very easy, but then it's very important to know it. If you don't know it, then the rank suffers. So that's the
yeah.
mistake I made in my November attempt, but I did not do it this time. So that is why I said that, when you make your 20 rule book, it should be two things. It should be, forgettable stuff, and it should be the must-know stuff. Those are the two things that you need to focus on. So that's how you can.
Great. And Anshul, मेरे को एक बहुत और question पूछने का मन कर रहा है. I'm listening to you as if I'm also an aspirant and I'm going to prepare once I listen to you. So now the more you say out your strategy, I feel like asking you more questions. So another one, because it seems to come from your heart, and I think it's not made up at all. He's actually telling what he's really done. So that is really commendable to tell others. You need a big heart for that. So अंशुल, मुझे एक चीज बताओ कि हर एग्जाम में ना बेटा कुछ यूनिक चीजें आ जाती हैं, है ना? जैसे अगर हम पिछले में देखें तो कुछ यूनिक चीजें आई थी, जैसे एसिलीन प्रेगनेंसी. अब प्रेगनेंसी में और बहुत कुछ है पढ़ने को, एंड यू रियलाइज अच्छा ये आया था. तो आई वांट टू नो व्हाट वाज योर स्ट्रेटजी विद रिस्पेक्ट टू पीवाईक्यूज एंड यूनिक थिंग्स. दे वर आस्क्ड like once, never before, and how much depth would you suggest someone to go into? Because I feel at my level, I feel that those questions which seem unique, as you said, can be answered from educated guesses.
Yes,
So,
ma'am.
but I really want to know your take on it.
Ma'am, actually, I was like thinking about this after the exam. Ki, मैंने तो ये paper दे दिया, but if someone sees the recall and they see कि they asked about nomogram used for dosing of vancomycin, so how would
Yeah.
someone react to that? If it were me also, I would think कि शायद ये nomogram पूछते हैं, तो मैं इससे जाके पढ़ूंगा कि मतलब I should go into that. But see, that's where I think a general sort of sense comes in. If you have given the exam once, तो बहुत ही अच्छी बात है. But even if you haven't, तो भी after doing one reading of the syllabus, you will come to know कि ये चीज कुछ ज़्यादा ही atypical है, and this will not be the rank deciding question in the exam. Because I can vouch for this myself, having given these 3 exams, November INICET, NEET, and INICET. The most important thing in the exam, which I tell myself before I click start, is that I cannot get any easy question wrong, and that is what is going to ensure that I get a good rank within 100. After that, it's all about how much you are lucky that day and you're able to make educated guesses based on your entire MBBS knowledge. So then a lot of things come. But to make sure that you get into the top 100, all you actually need to do is do the must-know topics and make sure you don't make any easy question mistakes. That is all. And I think that is why those googly questions which you see in the recall, they are not that important unless they are repeated. The more important stuff is which is the must-know stuff, and you cannot go wrong there at all. That is the main thing.
And it's a very kind request to whoever is listening to him. इसने एक golden बात बोली है, क्योंकि नहीं तो आप लोग सफर करोगे जब आप अगले एग्जाम की तैयारी करोगे और आप ये वाला पेपर करने की कोशिश करोगे as a PYQ, and if you think that you have to go into the tiny bits of these vague and weird things that they've asked, please believe me, you'll lose it. So what he has done is absolutely right. This is what you have to do. You can't run after vague and weird things. You have to presume कि आपकी basic knowledge से maybe some pharmacology, maybe some path, वो कहीं ना कहीं से rule out. Rule out is the key thing. And that's what he means when he says educated guesses. So please don't think कि paper अगर difficult आता है तो weird चीजें पढ़ने से rank आएगी. अंशुल, क्या आपने weird चीजें पढ़ी थी?
No, ma'am. I made sure कि मेरी मतलब preparation का जो graph है, it should be like having spikes. It should be very, very deep where it's important, but it should only be basic surface where it's not. Because if I start reading everything, I won't be able to revise, and I will end up with a similar rank like I did previously. Because that is a mistake I had made. I didn't want to repeat it. So I think
excellent. Anshul, I think that it's a very well-deserved rank, क्योंकि जैसे मैंने पहले बोला, अंशुल ने हार्डवर्क भी किया है, उसने अपनी मेहनत भी करी है, उसने स्ट्रैटेजी भी लगाई है, और हर चीज का कॉम्बिनेशन करने से वो यहाँ तक आया है. And that's how you should prepare for your exam, which is a competitive exam. It's a very common sense advice he is giving. Unlike toppers who would like to say कि ये भी कर लो, वो भी कर लो, please listen to him. It's actually what he needs. He said what is the truth. So absolutely wonderful, Anshul. मुझे सच में बहुत अच्छा लगा आपसे बात करके भी, आपकी strategy सुन के भी, और I feel that you are bringing out the key things which one needs to know, right? अच्छा अंशुल, अब फटाफट कुछ चीजें मुझे बताओ बच्चे कि पेपर के वक्त you also must have come across some weird things or difficult things or whatever word you want to give. तो how do you maintain your calm? How do you maintain your speed? Because इस बार भी बहुत सारे बच्चों को time short लगा था. And how many questions do you keep for review? Because these things are different between NEET and INI.
So, ma'am, before the exam, I had only one thing in mind. कि now जितनी भी information है, that is all on me. वो सब हो गया. That's in the past. But now I have to just make sure that every question is a challenge, and I have to get to the answer, irrespective of whether or not I know the stem or not, or I know anything about it or not. Because I remember even in NEET, I had some questions which I had not really studied, but then just by eliminating, I was able to get to the answer. So that was my main strategy, to not see the paper as कि ये नहीं आता है, but to see it as कि I'll just try to get to the best answer I can. If I cannot, I will leave it. So, like I said, I left only 6 questions because those were questions where I had actually no idea of any leaning towards any one option. But I usually attempted all questions where I was able to eliminate at least one or 2 of the options. And the other thing was that I planned to mark only 10-15 questions for review and to give them a good go in the first attempt itself. But like in exam is tarah ka hai ki I ended up marking around 25 questions for review in the first 100 questions. Oh. So that was a lot. And I was like, if I go at this pace, it's not going to work out. So in the next 100 questions, I tried to go faster so that I was left with around 20 minutes in the end for around 34 questions to review. So out of those questions, I just again, went ahead and those who rule out kar liye the, I just looked at the other two and tried to get the best answer. So although I marked more for review than I had planned, but I think such things should not fluster you in the exam because एक idea होना चाहिए कि हाँ इतने छोड़ूंगा इतने review के लिए छोड़ूंगा तो I will be able to complete it in the end. That should be the basic goal. So I had an idea कि 20 minute में हो जाएगा. So you should have to plan within the exam also because paper can be like different from what you imagine, not different. And whenever you see a tougher question, you should read every option. Like even in pharma this time, there was a trophenatide question. So you could actually rule out the other options because all the other drugs were known. G-Panks would be for migraine, etc. I don't remember all the options, but I'm sure it was easy by elimination. But when I saw the question first, I thought it's very difficult. But then after eliminating, it becomes easy. So that should be the goal. And yes, saying a lot.
Perfectly said. Perfectly said. Okay, Anshul, so what branch do you want to pursue, Bacha?
Ma'am, I had actually not thought of this because I wasn't expecting such a good result, but I think I would like to go for internal medicine from my own college, that is INICET.
Chalo, wonderful. So wish you a super bright future ahead, Anshul, and I must congratulate you once again, not just for, working hard, but I think also planning it very well because that is an essential part of the preparation. Also maintaining your cool and, coming out as a winner. So any motivational thing or anything that you would want to say, which is non-academic to know your other colleagues who might be wanting to appear for the exam next year or next session.
I think I would like to repeat what I said during my NEET result as well, that discipline is much more important than motivation. It will always be your friend, even if you do not have motivation in your life. So go for discipline.
Great. So great. So the entire DAMS family wishes you a very bright future ahead. And I'm sure whatever branch you're going to take, you're going to go all out in that as well. And that's what we need from each one of you. So hats off. Heartiest congratulations once again. And thank you for making us a part of your journey, beta. God bless you.
Thank you so much, ma'am.
Take care, Anshul. And give my regards and, congratulations to your parents also.
Yes, ma'am. Thank you so much.
Take care.